Hi, my name is Addie St. Clair, and this is video number 2 for Dr. Kopath, section D2 for physical assessment. Hi, my name is Addie St. Clair. I'm going to be your nurse student this evening. How are you today?
I'm fine.
Very good. Can you tell me your name?
Vilma.
Okay. Vilma, we're going to conduct an abdominal and a musculoskeletal and a neurological evaluation. Let me wash my hands, okay? And as I go, I'm going to go ahead and explain everything to you as I go. But if you have any questions or any discomfort in the person, you let me know, okay? So I wash my hands. I want you to go ahead and lay down supine. There you go. Excellent. And then one of the things that I'm going to begin to do is the abdominal assessment. So that it takes part of doing the inspection first of all. So let's lower this down a little bit. Okay, we're going to minimize exposure. Okay, so just to look at the abdomen, I'm going to inspect for the contour, for the shape, for the size, for any scars, for any protrusions, and also for vessels. Okay, and I see that it's nice and round and it's nice and even. I don't see any protrusions. I'm going to proceed then to auscultate for the vowel sounds, and I'm going to begin with the right lower quadrant, and I'm going to proceed with the right upper quadrant, and I'm going to auscultate the left upper quadrant, and then the left lower quadrant. Okay. In addition to that, I'm going to proceed to auscultate for fluids on the aorta, and I'm going to actually proceed to also listen to the renal artery, and then the iliac, which they tend to be also at the level of the navel, it's slightly below. Into the left iliac. And then I'm going to proceed to listen to the femoral artery. Into the left femoral. And I can hear a strong pulsation, but I don't hear any fluids. Okay. I'm going to actually proceed to conduct the percussion of your abdomen, general percussion. Now, after that, I'm actually going to percuss for the liver, and I'm going to do the lower border, and then the upper. Okay. And I'm also going to percuss for the spleen. And the liver has a dull sound, and the spleen has a more tympanic. And I'm also going to percuss for the bladder. It tends to have a tympanic, but usually you listen for that sound when the bladder's full, between 400 and 600 cc. Okay. After the percussion, I'm going to actually palpate with one hand, and that's a light palpation. And I proceed to do with the right lower quadrant, then the right upper quadrant, and then the left upper, and the left lower. Now I'm doing the very light palpation in all 4 quadrants, but I also need to do the femoral artery. So I'm going to palpate. There you go. It's nice and strong and bonded. And I continue to do that on the left femoral artery as well. There you go. Okay. I'm also going to try to feel for the inguinal lymph nodes for any inflammation, any swelling, any tenderness.
No.
Okay. Now, the next step to conduct will be the deep palpation. And with the deep palpation, we actually focus on three organs, and that will be the liver, the spleen, and the kidneys. So for this one, I'm just going to put my right hand on your mid to lower back, and then I'm going to ask you to take a deep breath for me. Deep breath, and there you go. Let go. Very good. And I'm trying to palpate for the liver, the interior. And then I'm going to repeat the motion with the spleen. I want you to take a deep breath and let it out. Very good. You're doing really well. Okay. And the spleen should not be able to palpate. Okay. And then for the kidneys, we're going to repeat the operation. I want you to just relax. Okay. And let me know if you're feeling any tenderness. Okay. And that's it for the left kidney. And then the right kidney. Okay. Okay. And that concludes the abdominal assessment. Okay. You did a terrific job. Now, the next step that I need to do is actually evaluate the musculoskeletal joints, and that will begin with the hip. Okay. So for this, I need you to bend your legs, bend your knees slightly, and what I'm going to do is just assess the right hip first. Okay. For the right hip, I want you to bring your knee as close as you can to your abdomen. Very good. Excellent. And I want you to go ahead and push against me. Push my hand away. Very good. And now stretch out your leg, and that's extension of your hip. Okay. And I want you to push down. Very good. Push up, 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 up. Excellent. Can you push inwards? Inwards. There you go. And push outwards. Excellent, excellent, excellent. And then I want you to lower this down, and I want you to bring your leg across. There you go for adduction, and then adduction. Very good. Excellent. We're going to repeat this with the left. Okay. And I want you to bring that leg all the way up. Excellent. Up, 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 up. And I want you to try to push that leg down. There you go. And push up, push up. There you go. Push my right hand. There you go. Excellent. And then and you're going to extend that leg out. Excellent. Bring it inwards and outwards. And I want you to push my hand. Push my hand. There you go. And push my hand again outwards. Excellent. And I want to see if you're rotating that. Okay. So I want to see you rotate internally and then externally. Sorry. Allow me to do this on the other right that we briefly skip that one. Externally and then internal rotation of the hip. Excellent. Any discomfort? Any pain? Okay. Now we're going to proceed with the knees. We're going to do the similar thing. And I want you to go ahead and flex that knee. So bend it. Very good. Excellent. Now, can you push your leg up? There you go. And bring it down. Excellent. That's very good strength. Very resistant. And what I want to do is actually rotate your knee. There you go. Inwards and outwards. Okay. Very good. And we're going to repeat that with the left knee. Okay. So you bend. And then push up. Push down. Excellent. And then you rotate inwards. Very good. Okay. And push my hand in. There you go. Push out. Excellent. Very good. Very good. And now we're going to do the inversion and eversion and eversion. Okay. Inversion and eversion of the ankle. So with the inversion, so you're going to try to kind of twist inwards, if you will. Inversion and then outwards. So eversion. Excellent. Very good. And then I want you to push down. Excellent. And push up. Outstanding. So hyperflex and hyperextend. So you bring your foot down and bring it all the way up. Excellent. That's excellent. And then you can rotate. Beautiful. Very well done. And again, we're going to do the twisting inwards, which is inversion, and then eversion, and twisting outwards, like so. Very good. And then push, 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 and pull up, 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 up. Excellent. And rotating that ankle. Does that hurt at all?
No.
Okay, neither one of them. Okay. Now, with the toes, let me see if I can just make sure the camera can see it. Okay. So I want you to try to see if you can actually push with your toes. Push my hand with your toes and pull up. Excellent. Can you stretch out your toes real big and kind of wiggle them? Wiggle, wiggle, wiggle. Excellent. Very good. And then the same thing with the left toes. If you can push me, but there you go, and push out with those toes, and then wiggle them around. Excellent. Now, for the next test, that concludes the musculoskeletal assessment of the lower extremities. We're going to proceed with the upper extremity, but for the upper extremities, I'm going to need you to assume a sitting position, okay? So, I need you to sit up. Excellent. So, the first thing I need to do is actually inspect and see that they're nice and even. Uh, the acromyoclavicular joint is important because that has both the acromion process, it has the scapula and your clavicular area. So this bony prominent right here. So I want to make sure that, does that hurt you?
No.
And then I can dig in a little bit from the back just to make sure it has nice movement. Okay. The same thing with inspection of the right side of the acromyoclavicular processes. Excellent. And then I'm going to proceed to look at the elbow. And the elbow, I'm going to have both the lateral and the medial processes and feel them, both on the left side and the right side. And then also I'm going to proceed to the wrist. And one of the things that I'm going to try to do is look at the phalangeals and the metacarpal phalangeals for any bony prominence and or any evidence of swelling or tenderness on those areas. And then I'm going to go to the proximal interphalangeals and the distal interphalangeals, and just to see if there's any evidence of swelling or tenderness in any of those joints. You feel any of that?
No.
Okay, let me do the wrist, the left one. Again, the metacarpal phalangeal. I don't feel any. And then the proximal interphalangeal, and then the distal interphalangeal, and no tenderness or swelling evident. Okay. Now, after doing the assessment and inspection and palpation of the upper extremity, I'm going to proceed to do the range of motions. So what I want to do is, with your arms, I want you to bring them straight up in front of you if you can. There you go. You comfortable? Let's see if you can actually turn to the camera. Okay. And what I want you to do is post resistance for me. Push down for me. Excellent. Excellent. And then, so that is your, extension. Very good. And then I want you to bring them back all the way to the back. Excellent. I want to push down, and push up, up, up. Excellent. So you have good flexion and good resistance. And then I want you to actually bring your arms out. Yeah, exactly. Just like a T. Bring down, push up. Oh, excellent. Very good resistance. And then you're actually going to bring the right hand in front of you. Oh, the left hand in that case, that will be fine. Now I want you to push against me and push against me again. Very good. Keeping that arm straight. And you're going to do the same thing with this one. You're going to bring it across, and I want you to push, 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 push. Excellent. So that just gives me, a good idea that you have very good, strength. So push inward with both, outwards. Excellent. You did terrific. So, and that actually is telling me the strength of those joints on the shoulders. Okay. Now for the elbows, I'm going to ask you to just kind of flex and then extend. Okay. You're going to do the same thing with this one and bring it down. And what I want you to do is bring them up together and push me. There you go. See how that elbow is doing. And push. There you go. Pull, pull, pull. Excellent. And then what I want you to do is supination and pronation. There you go. Kind of a patty cake, patty cake. Very good. Excellent. So now that actually concludes the part with the elbows, range of motion. And actually, that tells me good rotation when you do the supination and pronation. Now with the wrist, I want you to do this motion, like you're showing my 10 fingers. So that way you have, the extension and then the flexion. Very good with the wrist. Excellent. And then if you can rotate in outwards and then inwards. Excellent. You're doing terrific. Now with the fingers, what I want you to do is actually hold this position like so, and then flex with your toes inwards like that. Nice. And then extend it outwards. And then I want you to rotate your thumbs, okay, for adduction and adduction. Okay, so you're going to move the opposite way. Just the toes, not the rest of the hand. Just the hands hold it. And then you are going to actually kind of try to reach for that little pinky. There you go. So we see a nice extension right there as well. Very good. You're doing terrific. Now, that's for opposition, by the way. So when you're reaching out for the little pinkies. And then I'm going to do an inspection of your back. You can turn a little bit to your right so that way the camera can see. And one of the things that I'm looking for on the back is the inspection of any curvature or on the cervical area. So if there's any evidence of kyphosis or lordosis or scoliosis or any curvature sideways. Okay. In addition to that, one of the things that I'm looking for is if is any abnormalities with muscles surrounding the back as well. So look at the cervical, the thoracic, and then the lumbar, and then all those paravertebral muscles to make sure that there's no stiffness. And then we can use my thumb just to make sure that we go all along. Okay, any pain? Where? No. Or tenderness? It doesn't feel like any swelling or any protrusion of the vertebrae. And also the muscles, the paramuscles, paravertebral muscles, they feel nice and even, and there's no evidence of any asymmetry. Now, if you can turn to your left, so that way you can face the camera, please. Okay. Alrighty, we're doing really well. Okay, so I want you to tell me what's your first name is.
Vilma.
Okay, can you tell me where you are, what city and what state?
I'm Bowie, Maryland.
Very good. Can you tell me what year it is?
2015.
Very good. How about the time? What month?
This is April, and the time is like 11:25 or 24.
Okay, very good, very good. Now tell me, what date of birth was your child, one of your children?
What is the birthday?
Yeah.
My son is June 13, 1971.
Very good, very good. What kind of music played back then?
Disco.
Disco, all right. That was terrific, very good. So you remember. That's my favorite kind of music too, disco music. So how about recent memories? Can you tell me who the President of the United States is?
Barack Obama.
Barack Obama, that's right, that's right. And how about any other recent events that happened in the last 24 hours? Anything exciting what's happening tomorrow or near this time?
Near this time we have a Good Friday, and we have the news about the conversation our president with Iran to resolve the peace.
Okay, very good, very good. I'm glad you're keeping an eye on the news. That's true. Now, for the next thing that I need to do is for reasoning. So I'm going to ask you, when I say something, when I say this expression, I want you to tell me what does it mean, or what does it mean to you. It's better to have one bird in one hand than two in the bush. What does that mean?
The mean is, it's better you have one job in your hand than two coming in the way.
Okay, very good, very good. Now, the next part, I need to actually see how your brain is able to do calculation and how to make deductions. So I wanted to ask you, if I say 100, 90, 80, 70, what will be the next?
60, 50, 40, 30, 20, 10.
Very good, very good. That's terrific. Now, and you're doing terrific. You're doing fabulous. Everything seems to be really normal. So now the next thing that I need to do is actually examine the cranial nerves, and they actually basically concentrate all in the head. cranial nerve number one. That's usually of the one for the sense of smell. And we are not going to test that so we don't trigger any allergies on you. Okay, I know you're sensitive. So therefore we're going to move forward with cranial nerve number two, and that's the optic nerve. The optic nerve actually responds to light reaction. Okay, it's responsible for that, and it's also responsible for movement. Okay, so you okay? So so the next thing that we're going to do is I'm just going to quickly look at your eyes and the light. Let me just turn this up to have a nice. Can you look at me? Very good. Look at me. Just keep looking at me. I'm going to bring the light on. Oh, you got tiny little pupils. But I see them. And they're very brisk. Very good. They're nice, equal, and reactive. I'm going to turn the light back on. And what I want to do, can you sit back a little bit for me? So that way we can still be in the view of camera and keep the adequate distance to conduct confrontation. So what I want to do is I'm going to be at the same level that you are, and then I want you to tell me when you start seeing and how many fingers you see in my hand, okay? So what I want you to do is cover your right eye, okay? And then I want you to actually keep looking at the bridge of my nose, so keep looking at right here in the middle, and I'm going to bring my fingers up, and I want you to tell me how many I have, okay?
2,
Very good.
1,
Very good.
2, 3.
Okay. Alrighty. So I'm gonna do the opposite thing. I want you to cover the the left eye, and then we're gonna do the same thing. Can you tell me what you do?
2, 1, 2, 3.
Okay, very good, very good. Alrighty. So for the next one, that actually is a confrontation. So we're testing for your ability to have visual fields, peripheral area, and that's what the nerve is in charge of. For the next one is it's a group of nerves that work together to try to do it. Is the cranial nerve number 3, 4, and 6, and they basically are responsible for the movement. So what I want to do now is actually I want you to look at the tip of this cotton Q-tip right here, and I want you to look at it and follow it. Okay, don't move your head. You're gonna follow it with your eyes. Okay, you're gonna. Okay, and we did all 6 different positions to see if your eyes accommodate, and they really did. So your nerves are doing the right job at the right time. The next thing that I'm going to test for both the oculomotor, which is nerve number 3, and also for the trochlear nerve, and that's number 4, and then the abducen nerve, which is number 6. Now for number 5, I'm just going to ask you to close your eyes, and I'm going to use a cotton ball, and I want you to tell me where am I touching you, whether it's on the, let's say, right side of the cheek or the left side of the cheek. It's in your jaw and right or left side of the jaw, but I want you to close your eyes and tell me if you feel the touching, okay?
Forehead, right cheek, left cheek, jaw, left jaw, right jaw.
Very good. You have intact sensation. So that's what the cranial nerve number 5 does. Okay. For the next one, cranial nerve number 6, number 7 is the facial, and I want to do a series of movements of the facial muscles to see that the mobility is intact. So I want you to raise your eyebrows as high as you can. Can you do it in the front of the camera? And thank you. Okay, very, very good. Now I want you to close your eyes really tight. Excellent. And then I want you to make a frown, like you're really upset. There you go, very. And then I want you to give me a really big smile. Excellent, nice and even. And then I want you to go ahead and fill up your cheeks with air. Puff them all out. Excellent. Now for the next nerve, which is the acoustic nerve, we're going to actually do hearing testing, okay? So that's number 8. So we're gonna pretend that we have a tuning fork. Pretend that LifeFly is a tuning fork, and then I'm going to actually test for for your hearing. So the first test that I'm gonna do is a whisper test, and I have to keep about 12 inches apart, and I want you to tell me loudly what you hear that I'm whispering to you. Okay?
Dr. Copper is a good teacher.
Okay. Shameless plug for Dr. Kopak. Okay, now I'm going to do the Weber test. The Weber test is with the tuning fork, and I'm going to pretend this is the tuning fork, and I'm going to smack it and put it on the top of your head right in the middle, and then I want you to tell me if you can hear both equally on both sides. Okay, obviously you're not going to hear it, but we're doing this pretend, but you should be hearing it in both sides equally. Okay, if you don't hear it in one side, then that means that you may be losing some, hearing. Now for the next test is the Rhine or Renee test, and again we use the tuning fork, and then we'll put it on behind the ear where the mastoid is. Press this right there, and then once you start hearing it, I'm gonna stop it and then ask you if you hear when it stops. So just to see the acuity of your acoustic nerve. Now, for nerve number 9, the cranial nerve number 9 and number 10, that's the one that is the glossopharyngeal nerve, and that has to do with the gag reflex. So, for this purpose of this examination, we will not intentionally try to gag you because we know this is very uncomfortable. So, we're going to proceed with cranial nerve number 11, and that has to do with a spinal accessory and the sternal rotation, sternal innervation of the sternal muscles. So what I want you to do is actually, I want you to shrug your shoulders, bring it up. There you go. Nice. And it has good strength and good resistance. So very good. And I want you to turn your head side to side for me. There you go. Okay. So if you can, there you go. You turn it to the left, turn it to the right. There you go. And then kind of tilt it. So you have nice range of motion of the neck. Excellent. How about back? Okay, and bring it back. Excellent, that's outstanding. And finally, the cranial nerve number 12, which is the hypoglossal, it has to do with the conduction of the tongue, the coordination of the movement. So I want you to stick out your tongue, and I want you to move it nice side to side. Okay, very good. And that concludes the cranial nerves evaluation. Now, for cerebellar function, we are going to actually ask you to see that your cerebellar part of your brain is actually is intact. And what I want you to do is this cross a lateral movement and alternate movements that are rapid in front of you, and that actually gives me an idea that you have very good coordination. The other thing I want you to do is actually I want you to go ahead and touch your nose. Very good, and do it. There you go. Very quickly. And I want you to also try to touch my finger and touch your nose. There you go. Touch my finger and do it as quickly as possible. There you go. Quick, quick, quick. Do it with the left hand now. Okay, very good, very good. Excellent. And then the other thing I need to do also to test the cerebellar function is to actually see if there's any evidence of tremors. So I want you to stretch out your hands, and that's with any activity. Very good. There's no tremors. And what I want you to do is make an attempt to reach for this. See if it shows any evidence of any tremors. Can I see the other hand? See, reach for that. There you go. So I don't see any tremors, nor when in rest, nor also when it's in tension. Okay. Now, finally, for proprioception, I'm going to ask you to lay back down so that we can do this with the toe. And with the proprioception, actually, we're going to test the toe. I'm going to show you what I'm doing with the toe. I'm going to bring it up, separate it from the other toes with my index finger and my thumb. I'm going to bring it up towards you and bring it down. So I want you to close your eyes, and I'm going to do the same thing, but I want you to tell me if I'm doing it up or down. Okay?
Down, up, up, down, up, up, down.
Very good. Now I'm going to do the same thing with the right side, okay? With the right toe. Okay? Close your eyes. No peeking.
Up, down, up, up.
Very good. Excellent. So you have, intact proprioception. Now, for sensation, and we're almost finished with the um, part of the screening. I also need to do with testing of your sensation um, of your extremities. So what I want you to tell me if you feel soft and on each area. If it feels soft like a cotton ball, you say soft, and it feels smooth like the tip of the Q-tip, or if it feels sharp. So this is sharp. Can you feel that sharp? And this is kind of a smooth, and then this is soft. Okay? So I want you to close your eyes, and now I want you to tell me, is that smooth?
Smooth.
Okay, is that sharp? Okay. How about now?
Cotton. Sharp.
Okay.
Sharp. Smooth.
Smooth.
Cotton.
Okay.
Sharp. Smooth. Cotton. Cotton. Sharp. Smooth.
Okay. Very good. Very good. And then let me try the most distal area too. Close your eyes.
Cotton. Cotton. Sharp. Smooth. Sharp. Smooth. Cotton.
Okay. Very good. Now, for the purpose of the exam today, since we don't have a tuning fork, I'm going to use a flashlight to as a tuning fork. So I'm going to strike it, and then I'm going to put it on a distal bone prominence on the hand, and I want you to tell me if you will tell me when you feel it stop, or you feel it vibrating, and when it stops. So I will actually hold it like that, and then at any given time, I'm going to ask you you will have your eyes closed, and I will stop it, and then you'll let me know that it has stopped. Okay, I will repeat the operation again on the distal area of the left upper extremity, and then I will do the same thing with your toe with the tuning fork, and repeat the operation for those as well, and that is for vibration. Now for the next test, I need to do something called diagnosis, and I'm going to actually, in one hand, I'm going to write a letter, and I want you to try to tell me what that letter is. Okay, so close your eyes for me, and I want you to tell me the letter.
B.
Very good, excellent.
Seven.
Very good, excellent. So your diagnosis is intact. Okay, now we're going to proceed with doing, if you could sit up for me. Yeah, there you go. You comfortable like that?
Yes.
Okay, very good. I'm going to actually do something called deep tendon reflexes, okay? And again, I don't have a tuning fork, excuse me, a reflex hammer, so I'm going to use a pen knife to suppose that. So I'm going to bring that by the brachial, close to the brachial artery, not right on top of it, but close to it. And then I'm going to press with my thumb, and then I'm going to actually strike my thumb. And there you go, and you should have a nice reflex in the arm, kind of like a blink. Very good. And then we're going to do also the deep tendon of the tricep, and that's right below the elbow. Excuse me, right above the elbow. And then I'm going to strike it, and then there you go. That was very good. And we're going to do the brachial radialis as well, and then that will actually jerk a little bit as well. And let's try also the bicep. There you go. We'll pull, and then on the back here, and it will start right there above the elbow, and the brachial radialis. Be careful because you got that thing right there. So that actually concludes the upper extremity tendons. We're gonna do the patellar, and for that I'm just gonna assist you so that way you can see it, and then I'm gonna strike right below the patellar, And that will actually allow this to swing. And the same thing with your leg here. There you go. And now allow it to swing. And then for the Achilles tendon, well, I'm just gonna ask you to go ahead and keep that, and then hit the back of the Achilles tendon right there, and that will actually allow the foot to actually kind of kick, okay? And that will actually make the foot kick like so, okay? And finally, for the plantar reflex, so I will use something with a sharp edge, and then I can use my nail if that helps. And there you go. And we're looking for the Babinski reflex. And usually for most people, not for ticklish people, but you will actually curve your toes in, okay? But I know that you're kind of very sensitive right now, so, and you're kind of expecting that. So there you go. So, okay, that one did it. That curved in, so very good. Very good. Excellent. So that concludes the deep tendon reflex. Now for the next part, and we're almost done, I promise. Okay, I need you to stand up for me. Okay. Take your time. And then we're actually going to see your gait. Now I want you to walk slowly all the way up and then turn around and come back. Okay. Very good. Excellent. And what I want you to do is repeat this operation, but I want you to walk on your heels, and you're going to put one foot in front of the other with your heels. Okay? Just take your time. Okay, very good. With your heels. Excellent. Turn around. Okay, and I want you to repeat the operation, and I want you to walk on your toes. So tippy toe. Excellent. Nice and even, nice gait. And then what I want you to do one more test, and that's it. The wrong burst test. And the wrong burst test, you need to put your feet together, your arms together, and you're going to close your eyes, and I'm going to count until 30. See how you keep that position steady, okay? It's just to identify balances issues. And that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You're done. Yay, you're wonderful. You did a very good job. And this concludes the physical assessment for the abdomen, for the musculoskeletal, and neurological. Thank you. Thank you.